They're doing this because their patient is critical. Secretions are building up inside his chest and it needs to be drained. His body can't function normally because he's sedated and being kept alive by a ventilator. This is now standard respiratory care on a COVID-19 critical care unit. Tom has been on this unit for 3 weeks. He spent his 51st birthday here, alone.
I was absolutely terrified. You know, I'm in here, away from my family.
Tom's wife is a nurse. She realised his cough was more than a normal cold. Her action might have saved Tom's life.
I've been to hell and back. It's not been nice. It's a hard road, and it's a slow recovery. It's so evil, this thing. It doesn't care who you are. It takes you down, and it really, you struggle to beat it. Like I say, I've witnessed people go, you know, and they're not made here. You know, and that's a real shocker.
You've seen people die?
I've seen 2 people die in this ward while I've been on it. So, yeah, that's just harsh, you know. It's really harsh because it really gives you a reality shock of just how serious this is.
The intensive care unit at University Hospital Coventry has some of the sickest patients in the region. It's bracing itself for more as it faces a perfect winter storm. Non-COVID emergencies are spiking at the same time as COVID admissions. Hundreds of staff are off sick. Row after row, bed after bed, with some of the sickest patients in the region. There are men and women, young and old, black and white. Most are sedated and intubated.
So we've got 59 patients in the hospital that are confirmed COVID positive.
Inside the control room, Professor Kiran Patel is being briefed.
So we're maintaining cancer care?
Yes.
Yeah.
This is the beating heart of this hospital, where critical decisions are made. The hospital is at 98% capacity already, but Professor Patel is determined to keep all services going. It's putting the hospital under great strain.
I think this is probably one of the busiest winters I've ever experienced in the NHS. We take stock of how much elective care we can deliver, hour by hour, day by day, and we plan for the next day. And we will continue to do that for as long as it takes. And of course, I don't have a crystal ball, but there may come a point when the acute pressures are so immense that we do have to think about standing down elective care, but I'm hoping that we will not have to do that.
And if you're feeling too out of breath, stop, catch your breath.
One way to make space is by quickly discharging patients who are fit to return home.
That's it.
Paul came into hospital with backache 2 weeks ago, but he has COVID-19. He lives alone, and his physio team want to make sure he's strong enough to look after himself.
A bit strenuous at first, but obviously I'm out of breath now doing that, but that's only one flight, isn't it? When I get home, I might have to do that 3 or 4 times a day to get to the toilet.
Okay.
You know, that's the trouble.
In the bed across from Paul is David. He found out he was COVID positive after taking a test.
Tell you what, I wouldn't wish it on anybody. No way. No way. I wouldn't wish it on my worst enemy. Horrible. Horrible. You can fear the worst, can't you? You know, no matter how brave you are, you know what I mean? If you care for life, you care about yourself, don't you? But the staff have been absolutely excellent.
Dr. Chris Basford worked through the first wave. He told me much has changed.
It does feel different for a number of reasons. The patients that we're getting in now, we feel partly more confident in their management. We learned a lot from that first wave. We learned some of the treatments that help. We know that steroids help.
But even with all the advancements, the pain of losing a patient never diminishes.
It's never easy. As sometimes it is difficult. What I can say is that this is a team that knows what they're doing, and if you have a patient that you have cared for to the best of your abilities, and you know that you've done everything right, and they still didn't make it out of the intensive care unit alive, then that sometimes is something that you have to accept, and you have to try and leave at work and not take home with you.
The staff will do everything they can through another wave and through one of the toughest winters the NHS has faced. But they know more patients will die. At the start of filming, they had lost 6. By the time we finished a few hours later, it was 7. Ashish Joshi, Sky News, Coventry.